In this video, I will discuss the maxilla bone in detail. It is one of the paired facial bone. In complete skull model, appreciate the two maxilla bone meeting each other at the midline. These two bones are not fused. They are separate bones, thus making them paired facial bone. Maxilla bone is the largest pneumatic bone. In the medial view of isolated maxilla bone, appreciate this maxillary air sinus, which is the largest air sinus of all the skull bones. This bone is made up of a body and four processes, that is frontal process, zygomatic process, alveolar process, and palatine process. First, we will discuss the body of maxilla bone. The body contains maxillary air sinus that you just saw. You can also appreciate these maxillary air sinuses in the CT scan. These highlighted black areas on the CT scan are maxillary air sinuses. The body of maxilla is in the shape of a pyramid. The apex is represented by zygomatic process, and the base is represented by nasal surface. In this view, you can appreciate the pyramidal shaped body of maxilla bone. The body of maxilla bone has four surfaces: the anterior surface, the posterior surface, also called infratemporal surface, the orbital surface, and the nasal surface. First, we will discuss the anterior surface. In complete skull model, this is the anterior surface. The anterior surface is directed forward and laterally. In the anterior lateral view, you can appreciate the forward and laterally directed anterior surface. In isolated maxilla bone, close to the alveolar border, just above the canine, there is present an elevated area called canine eminence. Lateral and slightly superior to the canine eminence is present a depressed area called canine fossa. Superiorly, this margin between the orbital surface and the anterior surface is called infraorbital margin. Below the infraorbital margin is present a foramen called infraorbital foramen. Through it passes infraorbital nerve and vessels between the orbit and the face. Here in complete skull model, you can appreciate the infraorbital nerve, artery, and vein passes through the infraorbital canal, and this canal open anteriorly at the infraorbital foramen. At the medial side of the anterior surface is present a deep concave notch called nasal notch of maxilla. In complete skull model, you can appreciate that the nasal notch of two maxilla bones contribute in the formation of piriform aperture. Piriform aperture is a large pear-shaped opening found along the interior aspect of the nasal cavity. This highlighted opening is the piriform aperture. The margins of the piriform aperture is infralaterally formed by the nasal notch of both the right and the left maxilla bone, and superiorly by the inferior borders of the right and left nasal bones. Below and anteriorly, at the line of joining of the two maxilla bones, it forms a sharp bony prominence. This sharp bony prominence you can clearly appreciate in the lateral view and is known as anterior nasal spine. Next is the muscle's origin and insertion on the anterior surface. 5 muscles originate from the anterior surface. It include depressor septi, levator anguli oris, levator labii superioris, alar part of the nasalis muscle, and transverse part of the nasalis muscle. And only one muscle is inserted on the interior surface, which is orbicularis oris muscle. Depressor septi muscle originate from the maxilla bone just above the medial incisor. This is the medial incisor, and above to it originate depressor septi muscle. Levator anguli oris muscle originate just below the infraorbital foramen. Levator labii superioris originate below the infraorbital margin and above infraorbital foramen. Nasalis muscle has two parts, that is, alar part and the transverse part. Both of these parts originate from the interior surface of the maxilla bone. The alar part originate over the lateral incisor. This is the lateral incisor, and above to it originate the alar part, while the transverse part originate just lateral to the nose. The only muscle inserted on the interior surface is orbicularis oris, which is attached down and medially on the interior surface. Next is the posterior surface of maxilla body, also known as infratemporal surface. The posterior surface is convex in nature and it is facing posterior and laterally. In the posterolateral view, you can appreciate that the convex surface is facing posterior and laterally. It forms the interior boundary of infratemporal and pterygopalatine fossa. In complete skull model, this is the posterior surface of maxilla bone. This is the temporal fossa, and below to it, here is the infratemporal fossa. And the interior boundary of the infratemporal fossa is formed by posterior surface of maxilla body. Also note that there is present a fissure called pterygomaxillary fissure, and deep to it is present pterygopalatine fossa. In this image you can appreciate pterygomaxillary fissure represented by red lines. Number 2 is the pterygopalatine fossa. On medial side, pterygopalatine fossa open into nasal cavity via sphenopalatine foramen, while on the lateral side, pterygopalatine fossa open into infratemporal fossa via pterygomaxillary fissure. And the interior boundary of pterygopalatine fossa and pterygomaxillary fissure is formed by posterior surface of maxilla body. A thick bony ridge extending from the zygomatic process to the molar teeth separate the interior surface from posterior. In the lateral view, this is the zygomatic process and these are the three molars. This thick bony ridge separate anterior surface from the posterior surface. In the posterior view of maxilla, behind the third molar, generally 2 to 3 foramens are present. These foramens allow passage of posterior superior alveolar nerve and vessels. In this skull model, you can appreciate the posterior superior alveolar nerve and vessels passing through these foramens. Another feature on the posterior surface is this groove. You can appreciate this groove better in this image. This groove is directed forward and laterally. Through the inferior orbital fissure, this groove leads to infraorbital groove. Here is present the groove. This is the inferior orbital fissure. And on the orbital surface, this is infraorbital groove. infraorbital groove end at the infraorbital canal. This is the opening of infraorbital canal. And the infraorbital canal end on the anterior surface at the infraorbital foramen. The infraorbital nerve, which is branch of maxillary nerve, passes through the groove on posterior surface and enter the infraorbital groove through inferior orbital fissure. In the interior view of complete skull model, this is inferior orbital fissure and this is infraorbital nerve present inside the infraorbital groove. It enter the infraorbital canal on the orbital surface and leave the canal at the anterior surface through the infraorbital foramen. Near the third molar on the posterior surface is present maxillary tuberosity. The maxillary tuberosity is partially attached to the lateral surface of the pyramidal process of palatine bone. This is isolated palatine bone. This is the pyramidal process of palatine bone. It has three surfaces: posterior surface, lateral surface, and inferior surface. And out of these three surfaces, the lateral surface is attached to the maxillary tuberosity. Here you can appreciate that part of maxillary tuberosity of maxilla bone is attached to the lateral surface of the pyramidal process of palatine bone. That part of maxillary tuberosity which is not attached to the palatine bone will provide origin to superficial head of medial pterygoid muscle. So maxillary tuberosity has two functions. First, it provides attachment to palatine bone, and second, it gives origin to superficial head of medial pterygoid muscle. That's all about the posterior surface. Next is the orbital surface. The orbital surface is triangular in shape and it forms major portion of the orbit floor. In complete skull model, this hole is the orbit floor and the orbital surface of the maxilla bone form major portion of the orbit floor. The orbital surface is limited interiorly by the infraorbital margin. This is the infraorbital margin and it is continuous medially with the interior lacrimal crest. This interior lacrimal crest is part of frontal process of maxilla bone. The orbital surface has two borders, that is posterior border and the medial border. First one is the posterior border. The posterior border is free, which means it is not attached to any bone, and it forms the interior medial boundary of inferior orbital fissure. In complete skull model, this is inferior orbital fissure. The interior medial boundary of this fissure is formed by posterior border of the orbital surface. Near the center of posterior border, it forms a groove called infraorbital groove, which lead to infraorbital canal. And this infraorbital canal terminate at the infraorbital foramen on the anterior surface. Next is the medial border. The medial border most anteriorly form a notch called lacrimal notch, which is part of the wall of nasolacrimal canal. This is the skull model in which I have removed the frontal and parietal bones. In the superior view, this is lacrimal canal and this is lacrimal notch on the maxilla bone. which form part of the wall of nasolacrimal canal. The medial border is attached to three bones, that is lacrimal bone, ethmoid bone and palatine bone. Here again in this skull model, you can appreciate that posterior to lacrimal notch, the medial border of orbital surface is attached to lacrimal bone. Slightly more posterior, it is attached to ethmoid bone. And most posteriorly, it is attached to palatine bone. Slightly lateral to the lacrimal notch, the orbital surface give origin to inferior oblique muscle of the eyeball. This is all about the orbital surface. Next is the nasal surface. As discussed previously, the body of maxilla bone is in the shape of a pyramid, and this nasal surface form base of the pyramid. Major portion of the nasal surface is in the form of a hiatus, which lead to maxillary air sinus. In front of the hiatus is present a groove called lacrimal groove, and this lacrimal groove is converted to canal by combining it with lacrimal groove on lacrimal bone. This is isolated lacrimal bone. In the lateral view, this is the lacrimal groove. In this skull model, this is the lacrimal canal, and the lacrimal canal is formed by combining lacrimal groove on maxilla bone with lacrimal groove on the lacrimal bone. This is isolated maxilla and lacrimal bone. In the superior view, this is the point where nasolacrimal canal start, and below here it terminate, and in the nasolacrimal canal is present nasolacrimal duct. If I make the lacrimal bone slightly transparent, then you can appreciate the nasolacrimal duct in the nasolacrimal canal. Anterior inferiorly on the nasal surface is present an oblique crest called conchal crest, and through the conchal crest, maxilla bone is attached to the inferior nasal concha. Appreciate the inferior nasal concha attached to the conchal crest on maxilla bone. The upper margin of the hiatus is related to the ethmoid bone, and to be more specific, it is related to ethmoidal labyrinth. This is isolated ethmoid bone. These are labyrinths of the ethmoid bone, and here you can appreciate ethmoidal labyrinth attached to the upper margin of hiatus. Inferior to the hiatus is present a rough area and a groove. This rough area is related to lateral surface of the perpendicular plate of palatine bone. This is isolated palatine bone. Here is the perpendicular plate. It has two surfaces, medial surface and the lateral surface. And this lateral surface of perpendicular plate is attached to the rough area inferior to hiatus, as you can appreciate in this model. The groove which is present inferior to the hiatus will join groove on the palatine bone, and together will form greater palatine canal. Again, this is isolated palatine bone. Here is present groove on the perpendicular plate, which will join groove on the maxilla bone, and together these two groove form greater palatine canal, which is slightly difficult to appreciate here. In the medial view, I have made the palatine bone slightly transparent, so you can appreciate the greater palatine canal. This greater palatine canal end on the inferior side at the greater palatine foramen. This is the greater palatine foramen present between the maxilla and the palatine bone. And in the greater palatine canal passes greater palatine vessels and nerve, and exiting at the inferior side via the greater palatine foramen. So to summarize, the nasal surface is related to four bones. Interior to the hiatus, it is related to the inferior nasal concha. Anterior superiorly, it is related to the lacrimal bone. Superior to the hiatus, it is related to the ethmoid bone. Posterior and inferiorly, it is related to palatine bone. In isolated maxilla bone, the hiatus for maxillary air sinus is quite large. But when these four bones are joined with maxilla, the hiatus significantly obliterate, as you can appreciate in this model. The maxillary hiatus is obliterated interiorly by the inferior nasal concha, anterior-superiorly by the lacrimal bone, superiorly by the ethmoid bone, posterior and inferiorly by palatine bone. This is maxillary hiatus that you can see when all bones are joined together. This is all about the nasal surface. In next video, I will begin with the four processes. Thank you.